Welcome back, everyone. Please allow me to introduce our next speaker, Dr. Elizabeth Wayne. Dr. Elizabeth Wayne is a TED Fellow and Assistant Professor at Carnegie Mellon University in the Chemical Engineering and Biomedical Engineering. Dr. Wayne received her bachelor's degree in physics from the University of Pennsylvania and her PhD from Cornell University, afterwards completing a National Cancer Institute Nanotechnology training program, Postdoctoral Fellow in the Eshelman School of Pharmacy at UNC-Chapel Hill. Dr. Wayne is a strong advocate for women in science and entrepreneurship, and she will be presenting work on a scoping review entitled Nanoparticle-based Immunotherapy and Macrophage Activation. Go ahead, Dr. Wayne.
Hi, everyone. Thank you for coming to this session. This is such a great opportunity to talk about my foray into machine learning and SysRev platforms that can actually look at how to do systematic reviews. So I'm going to jump right into this. I'm really interested in cancer. I've done a lot of my PhD and postdoctoral, and some of the interests I have now are in cancer. And one thing you'll notice from this figure that actually is taken from the American Cancer Society and from the SEER program. Here you can tell is that if you look at from 1975 to 2016, the rates of cancer incidence are in some cases level or slightly increasing and then going up and down. And I think about how people often say, well, how can we make a computer that usually the size of a room that's now in my pocket, but we can't really make a lot of progress in cancer. And so cancer is this huge challenge that affects all of us in some way. If you then break down that data, you can look at cancer deaths among men, and you can see that kind of blip they had is really this lung number is related to decrease in smoking. But you can see that there's lots of different trends. Some cancer rates go down, some go up, but really this is a hard disease to treat. And the same trend that you'll see among females. Again, the lung is probably somewhat related to smoking. And there's also some areas of health disparities when you look between black, white. And again, these trends are all holding across all spectrums of looking at why is cancer so hard to treat and what's really happening. And so we often then think about, well, even though the numbers seem to be leveling off, maybe that's a good thing because it means that cancer deaths would have been much, much higher had they not had the kind of therapeutic, diagnostic, and screening interventions that we have had. And as a person who works in nanoparticle therapies, trying to design therapeutics, this question of why cancer is so difficult to treat can also take on a different meaning for me. And so part of this is that early screening and diagnostics. The earlier you can detect cancer, the better the outcomes may be. And the investment in these types of technologies. And then there's also the treatment aspect, which then really gets into healthcare and then clinical trials and efficacy and a lot of the kind of data that you saw Dr. Paller speaking about. And then as an engineer, I think there's this other aspect of drug discovery and development that's also really important actually to how we detect early screening methods and diagnostics, and also how we stratify patients. That can often be more of the preclinical basic research that is a huge swath of data that would be interesting to try to mine through and see which ones are successful, which ones lead to better efficacy, and how do we actually kind of combine these ideas to get to this better sense of treatment. Oh, I apologize. The movement on my screen is faster or slower than you are. So again, I actually am a nanoparticle, a drug delivery person, and I'm interested in how we can use immune cells for drug delivery and multiple facets of that. So what I spend time thinking about is how we can use immune cells for drug delivery, and that immune cells travel through our body. They know exactly where to go. They're like that trusted taxi driver going through New York City. They know all the cuts and the special ways to get places. And if we could design nanoparticles, we can tailor that drug to this place. And I think about those things. And I also think about the ways that we can actually design nanoparticles to actually have a specific function on the cells. And so one thing I'm leaving out in this talk is that this is a very important facet of cancer, because one of the reasons why it's also difficult to treat is that there's a lot of immunological barriers in cancer treatment, that cancer is inherently an immunological disease where macrophages in particular make up large portions of these cancers and can actually be a huge hindrance to therapeutics working. And so I think about how we can develop nanoparticles that can modulate their function. And so from that standpoint, it's kind of different but parallel to asking these kind of really interesting questions at the clinical level, because I want to take a step back and say, well, let's look at the data that people such as myself are actually accumulating at the bench or in animal models, and think, how do we work on those types of questions to get better answers? I think about drug delivery and the history of it, where when we first started thinking about cancer treatment, we were literally using mustard gas from World War I, and thinking about how mustard gas was actually depleting bone marrow cells. And so that was used for lymphoma treatment. So this idea of chemotherapy, going all the way to when at least in the US context, started developing programs for discovery. And this is really the framework for any type of clinical trials and preclinical drug development that we started developing in the 60s. And even then, we were still actually just taking natural products like paclitaxel, which is found in U-bark, and is really actually a frontline drug for many cancers for chemotherapy, that use chemotherapy still. So this idea that we can now really specifically design particles, tailor them to specific purposes, encapsulate them, and it's a really big challenge. And so you really think about this. This is also looking at a history of FDA approved nanoparticles. And so what I'm really trying to get at here is that we've evolved in our cancer treatment. There's lots of ways to deliver the drugs. There's lots of formulations. And as an engineer, we love thinking about how we can formulate something, what kind of nanoparticles, whether they're lipids, whether they're metal iron oxide, exosomes, which are cell-derived vehicles, carbon, print nanoparticles, quantum dots, how we load them, whether they have a diagnostic and therapeutic function to them. And this actually, something that I'm positing, actually makes this really challenging. And so when you think about in the basic or the engineering space, where we're really trying to design particles, design new therapies, we have all the ways that we can actually make nanoparticles. So size, shape, charge, the actual material that's being made, the degradation release properties of those. Then you have what you load it with. So are you going to use a chemotherapeutic like paclitaxel or doxorubicin? Are you going to combine that with maybe an siRNA or a nucleic acid therapy like siRNA, mRNA, DNA, maybe some other type of small molecule inhibitor? So there's all those combinations of that, including monoclonal antibodies. And then you can also think about how those things then affect the pharmacokinetics and dynamics, as in what does it do once it's in the patient's body? Combine that with the fact that there's also inter-patient and intra-patient, even within a single patient, the heterogeneity, where you really have to be able to understand how the first things on the left actually impact the things on the right, to then get towards this idea of patient stratification, which is in my mind, how do you know when you make a therapeutic, which of the nanoparticle formulations are going to be best tailored for getting to this point where you know whether a patient will benefit? Because I posit that not all of them, but a lot of the challenges with therapies is trying to identify patients and which type of drugs that they might need. And then also, out of the combinations that you have, which one of those combinations is actually the most efficacious? And from, again, someone who is a basic scientist, I'm calling myself basic because I'm not quite working in the clinic where we can design anything. How do we present these types of ideas to clinicians? And so for me, I think about my fields being very proliferative, and I want to actually be able to understand is there an identifiable relationship between nanoparticle characterization, because this is what we can do really well? There's the type of nanoparticle, size, shape, charge, surface charge, which has some other really fancy things about how you get into cells and get into parts of different organs. And looking at cargo and their ability to modulate immune cells, in this case, the macrophage polarization in the environment. And that this is a way to actually assess for the field of cancer therapeutics how nano-driven therapeutics can affect drug development and efficacy in treating cancer. And so the next few slides are actually about how we set this up, where we actually look through here all of the basic science engineering-driven databases, PubMed, Scopus, Web of Science, IIIE. And then we're also looking up places where other people look at data, like Google Scholar, Medline. Not all papers will be indexed, so we also then hand searched through some of the top journals that are publishing these papers to kind of search through within our period how many of them were not going to be indexed, but were still going to be relevant to our call. And then this is a sample of what our PubMed search looked like and how we tried to really find ways to encapsulate all nanoparticles. And this was actually a kind of a side note challenge because engineering and the nano field is so proliferative and so brand driven that it wasn't always going to be the case that people said nanoparticle. Like maybe they made, like we have a nanozyme, right? Or we have a nano spark, they would just kind of name things. And so you kind of have to figure out how to get them all encapsulated in the same terms. This is kind of where we start to use sysrev, and where we're actually using some other platforms to deduplicate, to accumulate all of the searches from the individual databases, deduplicate. We're using sysrev for the selection process, 2 independent reviewers. If they both agree, then that decision stands. If they disagree, there's a third person that makes a final decision to kind of be the tiebreaker. From our search as an example, we got some 13,000 unique entries. And then we trained sysrev using 7,000 of those papers. So we had students going through 7,000 papers. And then, there's some natural exhaustion happening, but they also got to the point where we decide, let's try to see how would we train the algorithm based on how we looked at our selection criteria. And then we did that to kind of use the algorithms to say the other ones were not relevant, and then did some spot checking. And so that was a whole interesting process we can talk about. So we had the title abstract screen, and that gave us about 1,300 papers. And this is, again, well, I didn't quite explicitly state it, but over 20 years of data. So we looked at the last 20 years as nano field and seeing what happened here. And we are currently in our full text screen where they're reading through and then looking at those criteria and then seeing how they fit. And then the next stage will be data extraction, where we're trying to actually see how we can answer our research question and then analyzing kind of the results that we find from that point. So I'd like to keep talking to people who are interested in this. I think that some points as I start to close that were interesting is that trying to map something. Well, first, let me talk about what's on the slide. So our team was big and expansive, and I think very important to making this process happen. One of the first things I did when I started this project was to reach out to the librarians at CMU, Sarah Young and Melanie Gainey, and they were very instrumental in this because Dr. Young actually has experience doing systematic reviews just in a different context in different fields. And what was really interesting about this was trying to figure out how to apply those kind of techniques that are maybe more used in like clinical trial studies or systematic reviews to these kind of papers that were not always presented different challenges. And another thing was the number of papers that we had to look at. That actually there were 13,000 papers that went through our search, and a lot of that is because, again, we make particles all the time, and we do all these different things and trying to figure out which ones are going to kind of make it out. So we also ended up having a large team of undergrads. And then what was interesting about this was that the students were actually learning a lot more about becoming more interested in machine learning, more comfortable with data analysis, with searching through text, that we didn't really expect that. And there's some interesting other data to talk about here. But I'm going to close and say thank you to the people in my group, and I'm happy to take questions at the panel session. And I hope that was a good summary of what we're doing and what we're about to do. Sorry, TJ.
No, Dr. Wayne, that was great. Thank you so much. This serves as an excellent time to remind everyone that there is going to be a panel session. So save your questions. You'll be able to put them in the chat. We'll read the good ones and definitely try to have some good conversation. But let's just keep moving. We're right on time. Up next is going to be Dr. Nasir Mirza. So please don't go too far. Thanks, everyone. Thanks, Dr. Wayne.
Thank you.